Removal of transplanted pancreatic allograft. The physician removes a transplanted pancreas graft. The physician makes an abdominal incision. The pancreatic graft is mobilized. The vascular supply to the pancreatic graft is isolated, ligated and divided. The anastomosis between the duodenum and bladder is taken down and the defect in the bladder is closed with sutures. The incision is closed. Removal of transplanted intestinal allograft, complete. The physician removes a previously transplanted intestinal allograft due to complications such as infection or rejection. The physician makes an abdominal incision. The intestinal allograft is isolated and resected at sites distal and proximal to the anastomosis sites of the previously placed intestinal graft. The distal and proximal ends of the remaining intestine are reproximate using staples or sutures. The incision is closed. Mechanical removal of obstructive material from gastrostomy, duodenostomy, jejunostomy, gastrojejunostomy, or cecostomy, or other colonic, tube, any method, under fluoroscopic guidance including contrast injection, if performed, image documentation and report. Removal by contouring of benign tumor of facial bone, e.g., fibrous dysplasia. The physician removes a benign tumor from a facial bone by contouring the excess bone down to the appropriate structure. A transoral incision is made in the maxillary buccal vestibule. The physician reflects the overlying mucosa, exposing the excessive bone. Rotary burrs, files, and osteotomes are used to remove this bone. The transoral incision is closed in a single layer. Contouring is a makeup technique that uses cosmetics to define, enhance, and sculpt the structure of the face or other body parts, such as breasts. Removal of anal sedin, other marker. The physician removes an anal sedin or other marker. The physician identifies the sedin stitch or other marker at the anal verge. The sedin is divided and removed. The external anal sphincter at the level of the sedin may be divided. Removal of pancreatic calculus. The physician removes a stone from the pancreas. The physician exposes the pancreas via an upper midline incision through skin, fascia, and muscle. The pancreatic duct is opened and calculus removed. The pancreatic duct is connected directly to the small bowel for drainage. The abdominal incision is closed. Removal of implanted intra-arterial infusion pump. The physician performs an upper abdominal incision and exposes the hepatic artery while dissecting free the previously implanted infusion catheter. The physician removes the catheter, and may repair the arteriotomy with suture. The physician closes the abdominal wound, and may leave a drain in place. Removal of Thiersk wire or suture, anal canal. The physician removes a wire or suture that has been placed around the anal canal for rectal prolapse or incontinence. The physician makes incisions in the lateral perianal subcutaneous tissue. The wire or suture that is encircling the anus is identified, divided, and removed. The incisions are closed. Removal of synthetic rod and insertion of flexor tendon graft, hand, or finger, includes obtaining graft, each rod. Removal of synthetic rod and insertion of extensor tendon graft, includes obtaining graft, hand, or finger, each rod. The physician removes a synthetic rod used to create a natural location for a tube graft and inserts a flexor or extensor tendon graft. The physician incises the overlying skin and dissects to the rod. The rod is removed. A graft is obtained from the palmaris longus tendon or from the foot and inserted in the new position. The proximal and distal ends are sutured into place and the incision is sutured in layers. This code is reported once for each rod that is removed and replaced by a tendon graft. Removal of cerclage suture under anesthesia, other than local. The physician removes a cervical cerclage, a suture that had been placed to hold the cervix closed. A cerclage is most often placed when a cervix dilates too early during pregnancy and risks a miscarriage. The physician severs the sutures and removes them. This code includes anesthesia other than local.